Dr. Svendsen is from CDC. He's at the National Center for Environmental Health. He is the Director, Division of Environmental Health Science and Practice at the National Center for Environmental Health, CDC. With that, Dr. Svendsen, please.
Well, thank you. I appreciate the invitation to be able to come and speak with you today about climate change and human health and how there are implications in disaster medicine related to that. So on this slide, you can see the impacts of the changing climate on the weather around us, and then those impacts of the weather upon human health. The CDC is focused on climate change because of the impacts on human health that are very broad. Oh, you can go to the next slide, sorry. And you can see how broad they are here, from increasing risks of vector-borne diseases such as West Nile virus and Lyme's disease, to bringing more intense heat waves and greater frequency of severe weather events that could cause flooding and other catastrophic public health problems. So the impacts of these events on human health are around the outer part of this image, and there are many. Next slide, please. So the CDC's Climate Ready States and Cities initiative is a program managed by the National Center for Environmental Health to support the states and cities, as you just heard from John Baldas, to help to protect public health at the local level from the local impacts of climate change. We use a 5-step framework, which we call the BRACE framework, Building Resilience Against Climate Effects, which I will get into a little bit more here shortly. But this current funding that we have for this program was initially released back in April, and it was just awarded to 18 states and 2 cities this past October. And this work is designed to help build upon the previous work that's been done in these jurisdictions and to expand it more, to be able to have more actions and to evaluate those public health actions, to include and continue to promote health equity as a centerpiece of all that we do in these areas. As you just saw also from Dr. Baldas, how critically important health equity is within these populations. And also to have opportunities for optional components, which are unique to the jurisdiction themselves. So next slide, please. So this is a map of all of the different jurisdictions which have been funded through our climate and health program to date. And you can see that some are states, some are cities. We even have some tribal communities which have been funded through the program, and even some cities and federated states of Micronesia and other affiliated nations. So the impacts are very different in different parts of the nation and different parts of the globe, and the programs are set up to help support those specific differences. Next slide, please. So we do this through the BRACE framework, as I brought it up before, through these different 5 steps. So step 1 is really to look at and anticipate the climate impacts in the local community and to assess the vulnerabilities of the public's health to the impacts of climate at the local level. Secondly, then, that is taken to project out the disease or injury burden from those vulnerabilities. And then an assessment of the public health interventions that might be appropriate to help prevent those types of outcomes is undertaken. Next, the development of an implementation plan, an action plan is developed. And then lastly, that is put into place, then evaluated moving forward to look for continuous improvement of those activities. Next slide, please. All right, so looking specifically at some of these examples of climate change and how it affects public health, one direct health impact of climate change is extreme heat. So climate change is making heat waves worse. So higher heat increased increases humidity, longer and more frequent heat waves, and can lead to dehydration and heat stroke. So there are many different individuals who are more vulnerable to extreme heat, such as outdoor workers, student athletes, people who live in cities, and people who don't have air conditioning, people with chronic conditions, pregnant persons, older adults, and even young children. So heat has significant impacts on public health in the United States. And we've seen this even recently in this past year. But if we look at data from 2004 to 2018, on average, there were 702 heat-related deaths each year. But during the years of 2007 to 17, there was an average of 67,512 emergency room visits as well due to heat each year. So extreme heat events are becoming more frequent and more intense. So annual temperature increases have been steady, and the temperature increased 1.2 degrees Fahrenheit from 1986 to 2016, but it's projected to increase 2.5 degrees between the period of 2021, which is now, and 2050. So next slide, please. So here we have a map that was created by my colleagues in the Climate and Health Program to show the increase in extreme heat over time. This map of US counties represents the change in the number of heat wave days per year. And this is over a 38-year period between 1979 and 2016. So the counties in dark red exhibited here are the counties with the greatest increase in the number of heat wave days as compared to the counties in the lighter red, which had fewer to no increases in the number of heat wave days in the gray. Next slide, please. Well, to further elaborate and focus on extreme heat, this past year was an incredible example of that. Between June 25th and June 30th of this past year, 2021, most of Oregon and Washington were under a National Weather Service excessive heat warning. Hot conditions persisted in parts of Oregon and Washington and even Idaho through at least July 14th of this past summer. The record-breaking heat had the largest impact in Oregon and Washington, especially the Portland metropolitan area, where the temperature reached 116 degrees Fahrenheit, which is 42 degrees Fahrenheit hotter than the average daily maximum temperature in June. There are health consequences of extreme heat. So in a recent CDC report, my colleagues from the Climate and Health Program used syndromic surveillance data to track heat-related emergency room visits during this heat wave in the northwestern United States. So the mean number of heat-related illness emergency department visits in this region from June were 102, was more than 7 times higher than that same period in 2019, which only had 14. And during June 25th through 30th of this past summer, the rate was 69 times higher than during the same period in 2019, which was 424 visits versus 6 when the heat advisory was not in effect in 2019. So there were profound impacts. Next slide, please. So a public health response to extreme heat is further complicated during times like this, when we have COVID-19 and the pandemic going on. The use of cooling centers, or a cool site or air-conditioned building designated as a safe location during extreme heat events, is often a common strategy to help mitigate the impacts of a heat wave. However, the operation of a cooling center becomes more complex in order to reduce the risk of transmission during the times of pandemic, when you have to look at issues of transmissibility of viruses such as SARS-CoV-2. So here we show the CDC's interim guidance to reduce COVID transmission during times like this. And this includes improving air filtration, screening, and alternate cooling sites for symptomatic and asymptomatic individuals, and implementing utility assistance programs such as the Low-Income Home Energy Assistance Program and other types of programs that provide financial assistance for home air conditioner use. Enhanced communication material about COVID-19 on site can be provided to the public as well. So here is on the right, you can see an infographic which was produced by the American Public Health Association on tips to prepare for summer heat and COVID-19. This is an example of how climate change, which is causing heat waves to become more intense, has the potential to exacerbate the response to the global pandemic. So we have interventions which can address both risks and help to reduce the risks of transmission and the impacts of heat. Next slide, please. All right, well, heat is not the only concern. Climate change is affecting coastal flooding, according to the National Climate Assessment. The frequency, depth, and extent of tidal flooding are expected to continue to increase in the future, as in more severe flooding associated with coastal storms and hurricanes and nor'easters. Rising sea levels are more intense, can include more intense hurricanes, and can contribute to increased injury, gastrointestinal illness due to drinking water and swimming and recreational water contamination and death. So this is another concern that we have as well. Sorry, next slide. So climate change is expected to make hurricanes more powerful and more damaging. So here is an image of 3 hurricanes in the Atlantic Basin in September of 2017. These 3 hurricanes were Jose, Katia, and Irma. Hurricane Irma, which is in the middle, was extremely powerful and caused an immense amount of damage, an estimated $777 billion in damage, and at least 134 fatalities. The satellite image was taken on September 8th, and you can see the notation as to the image credit there. Next slide, please. So hurricanes. So seeking safety and shelter during a hurricane or other severe weather event can become more complicated also during COVID-19 and other types of pandemics. Emergency managers, shelter managers, and public health professionals are taking measures to reduce the possible spread of COVID-19 among people who seek safety in a disaster shelter. So the COVID-19 pandemic has further complicated these activities, disaster preparedness and recovery, and due to climate change, the risk of more powerful hurricanes is increasing and shows that we need to look at these issues more proactively. But with proper guidance, we can keep people safe during both of these types of emergencies. Next slide, please. All right, so beyond hurricanes and heat waves, we also have extreme weather. Climate change is also associated with increased extreme weather, as we have seen even this past summer in flooding in Germany and the fallout from Hurricane Irma in the Northeast. Increased frequency and severity of heavy downpours, floods, droughts, major storms can lead to injury, illness, displacement, and death. Individuals that are more susceptible to these types of events include people who lack access to evacuation routes, people with disabilities, older adults, and the poor. Next slide, please. The CDC's Climate and Health Program conducted a project to characterize the flood risks to healthcare infrastructure at the national level. Here we see a picture of Ascension's Our Lady of Lourdes Memorial Hospital in Binghamton, New York, on the left during a flood event in 2016. And the picture on the right is Mercy Medical Center in Cedar Rapids, Iowa, during a severe flood in 2008. Next slide, please. To characterize flooding risk, my colleagues used data from FEMA's National Flood Hazard Layer, which some homeowners might be familiar with, because if you have a home that's designated in a flood zone, you are required to buy flood insurance when you purchase a home mortgage. So these areas in pink are within the 100-year floodplain, which translates to about a 1% chance of flood in any given year. The areas in orange are within the 500-year floodplain, which translates to a 1 in 500 chance or 0.2% chance of flooding any given year. This is the region around Savannah, Georgia, and you can see that most of the region around Savannah is in a floodplain. So next slide, please. To roll this out to the national level, you'll see that there are dozens of medical facilities across the nation, hospitals that are within a 100 or 500-year flood zone hazard area, as you can see in the red dots or orange dots on this map. So CDC scientists also conducted the analysis for nursing homes, dialysis clinics, and other pharmacies as well. So the next slide, in this next slide, the results found that 9.3% of all hospitals were within a flood hazard risk zone nationally. Additionally, 10% of the nursing homes, 11% of the dialysis clinics, 12% of the pharmacies were within flood hazard zones. So CDC researchers also overlaid future climate projections and extreme precipitation forecasts for these facilities to determine how flooding risk will change in the changing climate. As you would anticipate, it's anticipated to get worse. So next slide, please. So how do we address this issue? We heard a little bit about urban planners and how important that community is within the disaster planning and preparedness activities within a city. So here are some examples of how the Climate and Health Program has looked at ways to mitigate some of these concerns. So our Climate and Health Program has started a dialogue with different types of healthcare stakeholders, such as hospital operations systems, nursing home care facilities, and other building managers, to make sure that our healthcare infrastructure is resilient to the effects of climate change. So some of the examples of some strategies that can be used are relocation of the critical essential services. These could include placing electrical generators in locations within the building which cannot be easily flooded. This could also include evacuation and planning for evacuation, training the medical staff to respond to flood emergencies, and other adaptation plans also include actual site modifications to the building site itself, such as infilling land that is prone to flooding, or building levees and flood walls around these medical facilities. Next slide, please. So flipping it around, the last part of the story is really, what can communities do? So for extreme heat, communities can develop a heat response plan. Developing and expanding the heat alert system is one example. Ensuring vulnerable populations can be reached easily during a heat event. Planning cooling centers ahead of time and staffing and readying them for the heat events during the heat season. There are also ways to cool your community itself by increasing tree canopy cover to help keep buildings and surrounding of those buildings cooler and the air around it cooler. Use cool paving and other types of reflective and porous materials in building within the urban footprint to help lower surrounding temperatures as well. And then for mental health problems, the communities can prepare an emergency plan that's addressing those as well. So developing behavioral health plans for disasters include clear messaging about access to mental health services and crisis counseling as well. For the next level, air pollution issues and communication, encourage active and mass transportation, such as walking, biking, and shared public transportation to lower the traffic-related air pollution. Reduce energy waste through energy-efficient buildings and vehicles. Winterize homes, offices, schools, and other buildings, and encourage the purchase and use of fuel-efficient vehicles. And then lastly, for storms and flooding, communities can prepare their infrastructure, identify buildings, roads, and other infrastructure that are most vulnerable to the damage from these types of events, ensure existing and new infrastructure can withstand increasingly intense storms and flooding, and to improve sanitation and water management in these regions.
I saw that.
To protect drinking water sources, delivery systems, and sewer overflows. So with that, I will close. Last slide. And thank you very much for the opportunity, and looking forward to the rest of the session today.
And Dr. Svendsen, thank you very much